Hi, I'm Dr. Thomas Cranfill, the National Clinical Director for 360 Care Dentistry. I would like to welcome you to 360 Care. Our mission here is to better the lives of our residents by improving access to quality dental care. At 360 Care, our dentists don't necessarily do the computer updates in the field. This job is for the technical assistants we work with. These techs are very important to the dental workflow of the day and are there whenever you need assistance. But it is a good idea to know what these techs do when they are in the field, how they log on to Nextgen, and how they check in a patient so that you can begin your exam. So what is Nextgen? Nextgen is an electronic medical record system which offers practice management, medical billing, and patient portal. Nextgen allows all specialties, audiology, podiatry, optometry, and dental at 360 Care to be on one platform where we can share patient data. In this video, I will introduce you to 12 steps on how we set up at the facility, how techs log on to Nextgen, how we check in and review a patient. So let's get started. Step 1, preparing for the facility visit. Before you go to any facility, the 360 Care staff at the main office works with the nursing facility to create a list of patients, their names, medical needs, a list of medications, and reviews for the insurance for billing purposes. A time and date are then scheduled for the facility visit. Step 2, arriving at the facility. When you and your technical assistant arrive at the facility, you will be provided with a room or space to set up for your exams. The tech will power up their computer and sign in to Nextgen and log on to a VPN, a virtual private network. This program is used to help safeguard the patient's private information while working at the nursing home. Step 3, logging on to Nextgen. The technical assistant locates and double-clicks the 360 Care portal icon on his desktop. This opens the portal where they will provide a username and password. Then they will click Sign In. Here, they click the Nextgen icon. We click through a few prompts and then select Connect. It may take the computer a moment to connect. When done, you should see the Nextgen menu. The tech will select Practice Management. On this screen, on the left is the username, password, and domain information. On the right, the Enterprise field should show Special Care Management. Nothing needs to be changed. The only thing we are going to do is select under Practice, the state we are working in. Today we will select Kentucky and log on. Step 4, Practice Management. This window is the Practice Management area. The only thing we are going to do here is to select the Appointment Book icon. You will see a list of patients. This is where we check in and create encounters for the patients being seen this day. At this point, we highlight the patient's name, right-click and select Check In, Create Encounter. You may see an alert prompt. For this training, we will close out any alerts. Step 5, creating an encounter. This is where the tech creates the encounter. They check to see that provider rendering has correct provider name and service location, then select OK. At this point, Nextgen takes us through an autoflow sequence of prompts. Once we reach the checkered flag, we are done checking in and creating the encounter. Step 6, the EDR, Electronic Dental Records. We need to log on to the EDR. This icon looks like a tooth located in the top menu bar. Here is where all of the charting is going to occur and where we will find all the previous notes for our patients. You may see a window pop up that says the rendering provider on the encounter is not the default provider. Would you like to set the default provider? The tech will set the default provider as you, the provider that is working on that particular day. This ties the provider to all the encounters for the day, so we would click Yes. Step 7, Patient Summary. When we click on Patient Summary, the current patient's history information is going to populate on the screen. The patient summary shows us where this is a new or established patient, or does this patient have any allergies, what medications they are on, or were they seen by another service. The main thing on the patient summary is the most recent date they were seen and what the services that were given. Once this has been reviewed, we can select OK. This closes the patient summary window. At any time, we can get back to patient summary by clicking this icon. Step 8, tooth charting. Existing, treatment plan, and completed. On this screen, we will find where we do our tooth charting. The technician works from a pallet on the right for the charting and completed procedures for that day. Also, this is where the history of the patient resides, along with any previous notes. This area is your treatment plan. We have some patients that are very established with a lot of information. So if we need to see further back, we can toggle the tooth chart and palette away. This gives the window more space and makes it easier to view more information. To bring the tooth charting and palette back, we just click the icon again. For this particular patient, we chart them as having an existing service that was done by an outside provider. The system marks the service as existing, so anything in blue is going to be existing services. If we were doing a treatment plan, let's say a filling, we would first mark our decay, select OK. Any decay is going to show up black. So if we were going to do a treatment plan for this filling, we would click on Resin, Treatment Plan, and select OK. This shows up on the tooth chart as red. You can see this patient already has extractions under the treatment plan, these root tips. So anything listed as treatment plan is going to show up red. If we are performing this patient's dental work today, we would go to Complete the Service and select OK. This will bring up Notes Replacements. We would go through and answer the questions. You'll see as you complete the questions, the program is building your note. Select OK when done. So any services that are completed will appear in green. So today we completed a filling on tooth number 11, and you will see that this is now green. So existing services in blue, treatment plan in red, completed in green. Step 9, taking and viewing X-rays. If the provider needs to see X-rays, they are housed here. The technician takes X-rays by selecting Capture and adding the X-rays to Nextgen using the X-ray Vision DCV app. To view any prior images, they would click on View. If they wanted to view X-rays, let's say from prior encounters, they would just highlight and view the study. This brings up the study. They can double-click and view a larger image. They can zoom in and get a full screen view of the image. They can go back if they need to view a different study. Step 10, adding notes. At this point, we want to make sure that we are completing and putting our notes in for all services for each patient during the day. Once notes are added, the doctor is going to need to review the notes to make sure it's accurate. At this point, they would sign off on the notes. If there needs to be anything specific for the patient that's not included in the doctor's note, we can create and include a doctor's note that is typed in using free text. The technician enters the note and the provider must review the additional note. If everything is correct, the provider can approve it. If anything needs to be deleted prior to it being approved, they can just highlight it. Right-click and delete. And that will remove it from the patient's history. So once everything is correct, click on Approval, select OK. At this point, the provider enters in their password. Once the note has been signed off and approved by the provider, this locks the note and the encounter. Step 11, EHR, Electronic Health Records. The EHR is where your tech will select your location and the name of the provider on duty for that day. They can either scroll down for the location or they can do a search. Click OK. The tech then chooses the provider. At this point, they launch the dental menu. So the tech is going to enter all our pieces for meaningful use. They're going to indicate whether the patient is new or established, the reason for the visit, their medications. If there are no medications or they need it updated, they can import the medications. Once imported and reviewed, they would select Meds Reconciled. We then move on to allergies. Once these are reviewed, and if there are no changes, they would select No Changes. If they had to add something, they would select Updated. Under Patient Education, we did a restoration today, so we are going to save this to an encounter. If there are no problems, the tech would select No Active Problems. We have completed the 4 pieces for meaningful use for dental. Since we are done, we would click Save and Close, and that closes out the patient. We will minimize this screen, and we are ready to jump back to the appointment book in Practice Management and check in the next patient. Step 12, closing out the day. At the end of the day, the provider and the technician print out any information necessary for each patient seen that day and leave the medical information with the nursing facility. This has been a review of Nextgen, an introduction on how the technical assistants log in and how to check in and review a patient. Let's review these 12 steps again. At 360 Care, we are excited to have you join us and look forward to seeing how you can make a difference in people's lives. If you or your tech have questions or encounter problems with Nextgen, please contact the help desk at 360 Care. I'm Dr. Thomas Cranfill, the National Clinical Director for Dentistry. Thank you for watching.